author which we have is presenting author and chief author Dr. Ankita. Teleconsultation. Ophthalmology reaching every nook and corner.
Good afternoon, everyone. I'm Dr. Ankita Thali, and I'm here to present Teleconsultation, Ophthalmology reaching every nook and corner. So teleconsultation refers to the use of technology to deliver... Thank you. Teleconsultation refers to the use of technology to deliver healthcare remotely. Ophthalmology is a technologically forward field, and the first project in teleophthalmology was published in 1975, and of course it left a major impact during the COVID-19 pandemic. The aim of our study is to analyze the impact of teleconsultation in India's rural community. Coming to subjects and methods, so these teleconsultation units are set up in the rural communities and are referred to as vision centers or VC, and each one caters to a population of around 20,000 to 50,000 people. Each one is equipped with slit lamp photo machine, fundus photo machine, Schiot stenometers, retinoscopes, an optometrist, and a good network for connectivity. Besides this, there are also sphygmomanometers, glucometers, electronic medical records, and an optical shop. So these optometrists basically take the history, perform the examination, take slit lamp photos and fundus photos, and send them to the doctors at the base hospital. So now coming to the base hospital setup, it consists of an exclusive room with 2 computers with good internet connectivity. At a time, there are 2 ophthalmologists and 2 staff nurses. The teleconsultation is then carried out with the help of 2 apps, mainly Skype and Remedio. So the video consultation is done with the help of Skype, and the photos are viewed with the help of the Remedio app. A systematic retrospective analysis was performed over a period of 18 months from April 2022 to September 2023 on data which was obtained from 41 such vision centers of our hospitals spread across 9 states. So these are our vision centers spread across India, except in Coimbatore, because in Coimbatore alone we have 17 vision centers. The data included the number of patients that were examined, treated, and referred to the base hospitals, the demographic profile of these patients, the conditions that were being treated, and also the number of patients that underwent cataract surgery. So what we found that the total patients we examined were 1,91,194 with an average of around 10,366 per month, and maximum number of patients was seen at Coimbatore, which is around 44.78%, again owing to maximum number of vision centers. Coming to the demographic profile, we found that most of our patients were females and most of them were more than 60 years of age. And the visual acuity of patients that were presenting to us was between 660 and 3/60, that is those with severe visual impairment. Presenting complaints, most common was diminution of vision, and coming to the diagnosis, most common was lens-related pathologies. But then again, like every other patient, there were more than 1 presenting complaints and more than 1 diagnosis for every patient. Discussion. So Bone et al. In 2020 found that with a population of 1,380 million, India had 270 million people living with vision loss and 9.2 million were blind. In developed countries, the average ophthalmologist to population ratio is about 39 per million, whereas in India it is only 15 per million. What makes things worse is within the country itself, there is a discrepancy, where in urban areas have got 1 ophthalmologist for 10,000 people, whereas in rural area, there is only 1 for every 250,000 people. So teleconsultation can help to bridge this gap. We found that females were more than males, which was similar to Sabharwal et al., which could be due to the inability to travel long distances and also due to the social responsibilities of the females. Most of the patients were more than 60 years with severe visual impairment. Also found out the same results were by Mishra et al. Could be due to increased longevity of the population and also again due to difficulty in traveling for such old patients. So we found that about 19.75% of patients had cataract and were advised cataract surgery. And among these, around 62% were below poverty line and underwent cataract surgery free of cost. 65,425 were prescribed medications on teleconsultation and found to have resolution of symptoms. And 30,840 were given glasses. By all of this, it is very clear that teleconsultation can help to reduce the burden on the healthcare system. Also, posterior segment pathologies, it is useful for diagnosis, referral, and treatment, and there are already studies that show teleconsultation is useful for early diagnosis. Similarly, glaucoma, which is an irreversible cause, it helps for early diagnosis, and there are already studies proving this. However, we cannot overlook the limitations, which are obviously the cost effectiveness. The initial cost of setting up a vision center is very high, but overall the long-term benefit is much more. Poor network connectivity in rural areas is another limiting factor, and difficulty in diagnosis of certain conditions with teleconsultation alone becomes difficult. But we cannot forget the benefits. That is beneficial to both ophthalmologists and patients, and it aids in case-based reference. Most studies show high satisfaction and acceptance level among both ophthalmologists as well as patients. Public awareness is increased, and it improves the health-seeking behavior of the patients. Furthermore, we can also have post-operative care and follow-up. To conclude, teleophthalmology serves as a good eye care delivery channel. It provides preventative, curative, and promotive eye care services in a sustainable way. No doubt it became a major source of access to healthcare during the COVID-19 pandemic, but now even during the post-COVID-19 pandemic era, it is here to stay. Thank you.
So, Dr. Ankita, you're from which hospital? I missed that slide. It was not here. You're from Arvind? Or?
Shankara Eye Hospital, Coimbatore.
Okay, so you're lucky to be in a hospital where they can afford to have
Yes, ma'am.
fundus camera and slit lamp
Yes,
camera
ma'am.
in vision centers
Yes,
also,
ma'am.
because in many of the government hospitals, as yet, we do not have that
True,
in
ma'am.
ophthalmology unit.
Yes, ma'am.
So yeah, teleophthalmology is a concept that has been going on for some years, and during COVID, it got an upsurge. Any questions from my co-judges or audience?
What do you think as the future? Exclusive teleophthalmology consultation or teleophthalmology as an additional tool to clinical examination or as a follow-up?
So as mentioned as one of my limitations that we cannot diagnose certain conditions with teleophthalmology alone. So it can be an adjunct to the regular consultation, particularly in the rural areas.
Okay, fine. So the next
Thank you.
speaker. Yeah, thank you, Dr. Ankita.